Hello everyone. You know that according to the analysis, the United States has experienced nursing shortage periodically since the early 1900s due to the World War and economic recessions. It projects that 1.2 million new registered nurses will be needed by 2030 to address the current shortage. Healthcare systems are overloaded with burden with high labor costs and shortage of healthcare workers. Due to proximity of the patients and medical staff, these systems are further challenged by new disease transmission such as COVID-19 pandemic. The COVID-19 pandemic has exposed gap in the level of care in long-term care settings worldwide. The most significant number of COVID deaths has occurred in senior and long-term care homes. So, to meet the needs of wards where medical assistance is at premium, presenting Grace, a robotic healthcare assistant designed to help nurses. She is the creation of the same company that built Sophia, a robot granted citizenship by Saudi Arabia. Here is the features. Grace is designed to interact with senior citizens. A thermal camera in her chest can take patients' temperature and measure responsiveness. Using AI and robotics in this context can help gather important data for healthcare providers to assess the well-being of the patient. Grace's resemblance to healthcare professionals and capacity for social interactions are aimed at relieving the burden of frontline hospital staff and being able to speak three languages. Grace is able to understand emotions, communicate on a human level in appropriate situations, and her human-like appearance facilitate trust and natural engagement and maintain constant empathy for patients without growing stress. Grace can simulate more than 48 facial expressions, and she distinguished a voice in hundreds of languages and determined whether it belonged to a male, woman, or a child. This makes it an excellent choice of customer involvement in healthcare. So, how does AI help in healthcare? First, provide real-time data. A critical component of diagnosing and addressing medical issue is acquiring accurate information on time. With AI, doctors and other medical professionals can leverage immediate and precise data to optimize critical clinical decision making. Next is streamline tasks. Artificial intelligence in medicine has already changed healthcare practice everywhere. Innovation include appointment scheduling, translating clinical details, and tracking patient histories. AI is enabling healthcare facilities to streamline more monotonous and meticulous tasks. For example, the system exists to automate appointment scheduling and patient tracking. Next is save time and resources. As more vital processes are automated, medical professionals have more time to assess patients and diagnose illness and diseases. AI is accelerating operations to save medical establishments precious productivity hours. In any sector, time equal money, so AI has the potential to save hefty costs. For example, it's estimated that around 200 billion is wasted annually in the healthcare industry. Many unnecessary costs are attributed to administrative strains such as filing, reviewing, and resolving accounts. Next, increase efficiency of the diagnosis process. Increased diagnosis efficiency is one of the benefits of AI in healthcare. A lack of medical history and large case loads can increase the chance of human error in healthcare settings. AI algorithm can predict and diagnose diseases faster than humans with minimal error. For example, a 2017 study shows that a deep learning AI model can diagnose breast cancer faster than 11 pathologists. Next is reduce overall cost of running the business. For example, if AI can analyze millions of images for signs of diseases, it removes the costly manual work involved. Patients are treated faster and more effectively, reducing admissions waiting times. Next is safer surgeries. AI is finding its place in healthcare robotics by providing efficient and unique assistance in surgery. Surgeons get an increased skill to operate in small spaces that might otherwise require open surgery. Robots can be more precise around sensitive organs and tissues, reducing blood loss infection risk, and post-surgery pain. Robotic surgery patients also report less scarring and shorter recovery times due to smaller incision required. So, team, why do you invest in AI? So, this is the right time to meet the needs of a world where medical assistance is at a premium. Combine robotics and advanced AI to assist medical professionals and securely collect biodata to deliver groundbreaking diagnosis advances. Business leaders and investors universally agree that artificial intelligence will transform business by reducing costs, managing risks, streamline operations, and accelerating growth, fueling innovation. The potential for AI to drive revenue and profit growth is enormous. Thank you so much for your time.